Up first this evening, are there more dengue-related deaths than is being reported? Well, the opposition People's National Party certainly thinks so.
The PNP held a press briefing today where a national appeal was also made for blood to help fight the worst cases of dengue. TVJ Shamela Pullen was there and filed this report.
There are 7 confirmed deaths from dengue. The opposition contends the figure is far higher, but unproven because the necessary blood test to do so has not been done. But while opposition spokesman on health, Dr. Dayton Campbell, continues to blast the response to the health crisis, he calls on Jamaicans to respond.
A lot of the persons who end up having dengue hemorrhagic fever is because their platelet count falls. The platelets are what causes the blood to clot. So we want to use this opportunity to make a national call for persons to go in and donate blood so that the ministry and the government will be in a position so that when these persons are affected by dengue hemorrhagic fever and their platelet count fall, that they can get platelets for transfusion.
Dr. Campbell was speaking at a PNP press briefing on Monday, at which he also criticized his government counterpart, Dr. Christopher Tufton, for not activating the $250 million emergency funds to fight dengue much earlier.
The minister continues to operate without consultation and consensus. I am prepared to say today, if the minister, having been forewarned, had sought to have discussion with me about an early spend for dengue, even if dengue did not reach to an outbreak, I would have been the first to defend his actions in trying to take measures to mitigate against us reaching to the point of having an outbreak.
His political colleagues and fellow doctors Shane Alexis and Maurice Guy also weighed in. Dr. Shane Alexis, a former president of the Medical Association of Jamaica and now PNP caretaker for St. Mary's Southeastern, says he expects the number of dengue cases to continue rising for the foreseeable future.
Because the nature of the disease is such that as you have more people who are infected, then clearly there are more people circulating. Mosquito population is going to still exist. We're not likely to eradicate the mosquito from the island. There are going to be people moving again after the holidays from Westmoreland to Kingston, Kingston to Portland, wherever all they have to go. School is open, and all it requires is that the mosquito bites an infected person.
For Dr. Guy, part of the challenge to confirming cases quickly is that there is only one lab that is certified to test for dengue in Jamaica.
There are private institutions which give IgG and IgM levels which are not certified by the ministry to do. So as private physicians, when we send to these private laboratories for these levels as an indicative suggestion that there is dengue, we get that, but it's only the National Public Health Laboratory that can certify it or certify it. The challenge that we have is that that laboratory is unable to process the amounts that, the numbers that are coming in.
Shamela Pullen, TVJ News.